Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk a little bit more about this follicular movement for extremely crowded cases. And you can go in, if you learn how to do follicular movement, let the follicle of the developing teeth move the tooth over. It'll do it without you touching that tooth, but you have to extract something in addition. But I'll show you which ones you get out here. I've got one video of about 4 of these cases we did, but we use follicular movement frequently if it's somebody that has to have a tooth out. We try to start out like that. And it's in our group of people, there wasn't a single soul that had ever done this follicular movement. So I wanted to make sure that you understand how you can do that, and it will kind of take care of a bad case where rather than trying to save the bicuspids and pushing those teeth back to do that, you can do this instead. So let's get started with this, and I'll try to see. This young lady came in. She was quite young when we started. This was 1974, and here she's grown up a little older, and I'm going to go through and see. And here she develops out completely mature, a very nice looking young lady, and we use that follicular movement in correcting her teeth. And I'll show you that. This is 1972. This was her models. This is 74. And we worked with her, and we did a slicing procedure on her to get room in there too. And somebody came in and put these silly plastic crowns over those teeth. I wish they'd have left them alone. But anyway, we'll go back here now. We're going to cover that with the x-rays, and you'll see what we did. This is 12 of 90. That's after it finished. But here's 1972. Yeah, that's a sorry picture there. You can't really tell. Now, let me get to the x-ray. All right, and when you do this, we did this slicing procedure, and you got these teeth lined up down here, but we were still really crowded on the case. And to finally end up having to take out the first bicuspids in there, and that's what this case ended out, where we took the bicuspids, but we kept the wisdom teeth. You can see the wisdom tooth over on this side over here, up there. Now here's what, okay, now we'll get into how you do this follicular movement of the teeth. You see you've got these 3 teeth trying to get into a space between here and where your lateral tooth will come in here, and you can't get those teeth in that space. And over here, the erupting cuspid was going straight into this permanent lateral right here. And so we had to get something to get it back. And up here, this cuspid's going into this lateral, so we have to come over and get the first bicuspids out. Now, over on this side, this cuspid is coming in to this lateral tooth right here, and notice this follicle is flattened out, so you take the tooth there. On the bottom, this cuspid's coming in, running right into this permanent lateral, and we take this out, and that'll pull it off of there. You don't have to do it. You just let nature do it. Now watch this, do this. Let's go, that's 1, and here's 2, and the thing, we slice those teeth trying, hoping to get room, but we couldn't make it, and so we have to come back and look at it. So we still need to take the bicuspids, the first bicuspid out, and then this is the first bi, and this cuspid will move over here. This is the first bi. Now watch the cuspids move. We're going to take that out, and some people would be afraid everything would go into the dog. So we took the baby teeth out, and we still hadn't pulled the bicuspids. And they're maturing. We should have done them a little earlier. So we're going to need to get in here and do that rather than wait and trim that up. So we take these teeth out. Now watch the follicle move. I'm going to go back through these x-rays, and you can see that x-ray move out. Now when we take that out, the cuspid came right on down in. These moved over. This is hollowed out there. It'll go, and we'll get it. This moved in here, and I hadn't done anything at all. Just make some room there by taking out those bicuspids. Now, this one straightened up, and this thing went here, and we didn't put any braces on there at all. Now with these teeth move forward, the wisdom teeth have more room to come in. These moved in here. Now I'm going to back up and we'll watch those cuspids. Now you see where they came down in place. And you watch the follicle around this cuspid. It'll get bigger, and it'll push this tooth out away from that, and then it'll erupt there. And you see how it did. See the angle of this cuspid? Watch that cuspid change now. I go back. See that cuspid space comes in here, and we take that out, and it really moves over. This one moved over. Those teeth came in with that way, with very little or no orthodontics at all, just follicular movement of the teeth. And now here she is in 12 of 90. And those teeth are in the mouth. The wisdom teeth have come in. So we traded wisdom teeth for a first bicuspid. And she had room for a wisdom teeth. She's 24 years and 11 months at this point right here. And she had those ridiculous crowns put on. But that's how you use this in extremely crowded cases. You can go along and see. We did the slicing technique to try to get those teeth room enough to let them come in, but there was no hope for them to do that, so we did that, and she had the wisdom teeth, and they filled in the space. So there's the little girl we started. There she gets a little older. There she is a teenager, and here she is a grown woman. And that's 1990. And you couldn't finish it a lot better than that. So I'll pass that on. And here is the finished product. So I hope you learned how to use this follicular movement. If you want a cuspid to move over in the correct place, get rid of something over here, and this follicle will swell and move the tooth by itself, and that happens. So thank you for watching, and I'll sign off here.